last question. Do you know or do you have any suggestions to like treatments for people with long COVID or like long COVID treatments?
Yeah, well, what I would say is that we desperately do need treatments because this is now thought to probably affect about 10% of people that have contracted COVID, that they've gone on to develop long COVID, although, of course, some of those will be recovering over time. Not everyone persists, but unfortunately, there's as yet not a single definite treatment available. And it's actually a really challenging field because, of course, we're talking about a multi-system disease. It can affect any of those organs or a combination of them. So that makes it quite difficult then to find a single unifying thing that you need to do to treat somebody. But we don't have validated biomarkers. People have been doing all sorts of systems biology analyses to identify biomarkers, and people have come up with panels of different inflammatory biomarkers and different things that might be able to predict disease. But actually then getting that to become either linked to a treatment or as a way of monitoring disease, there's nothing available at the moment. So nothing's been validated in that way. And pharma are not that interested in repurposing drugs that aren't going to be very high profit for them if they're off patent. So I think that it's actually quite difficult to sort of get work in that area. But obviously there's a great deal of interest in a whole series of different things which would fit in with some of the pathophysiology that I've been discussing with you. So obviously antiviral treatments is one option, but immune modulators, anticoagulants because of all the clotting effects that we're seeing, things that can modulate your metabolism, your neurological function, or anything else. So there's a lot of interest, and there are a number of clinical trials that are going on, and a few of them are starting to show some suggestion that we might be able to find things that can treat it. So one big trial, which was set up in America at Stanford, is something called Stop PASC, and they were looking at Paxlovid and seeing if you could actually take a course of that when you're diagnosed with long COVID, and if that would have any benefits. So we do know that at the time of having COVID, if you receive antivirals, you have a lesser chance of developing long COVID, and that kind of fits with the vaccination thing as well. Now, unfortunately, that trial has been terminated and nobody knows why. And they haven't terminated and said it works, which would suggest to me it's because it doesn't work. So it was meant to be a huge trial. And so my guess is that that doesn't work. But of course, people are looking at other things as well. So of things that are looking interesting and encouraging, there's an anti-inflammatory called montelukast, which is often used to treat allergic conditions, and it acts a little bit like a non-steroidal, but it's another anti-inflammatory, and that does seem to improve respiratory symptoms. And there's also a synthetic bronchodilator that's being tested. But again, that's possibly just all symptomatic. It's not really necessarily treating the underlying immunopathology. Lithium, which is used as, to treat people with mania and psychosis, that has been used to treat brain fog successfully. But again, it sounds more like symptom control than anything else. But people are looking at all sorts of things. So one thing that's been linked with COVID and long COVID is low growth hormone levels. So people are trying to give somatotropin, growth hormone, and seeing if that causes any benefits. Then there's another trial looking at a dopamine receptor antagonist, again for the neurological manifestations. And then other sort of immune modulators and inflammatory modulators, so glutamate modulators, kinase inhibitors, and a whole host of antidepressants are also being tried to help. So the bottom line is no, there is no treatment, but these are all in clinical trials, and there's a few that are showing some encouraging signs for certain of the features.